Dad bod to fit bod day 3. I was meant to upload this yesterday because I'm trying to do a video every day of just me chatting shit and trying to inspire people to exercise when they got mental health issues. But me and the missus, we've had some really bad news and we've been going through hell. Past couple of days, we've had some really bad news, so I didn't have no chance to do it. So this is yesterday's video. So TRT and the insulin syringe go together like beans on toast. Why on earth you'd use anything but an insulin syringe, anything bigger than a 29 gauge? It's just beyond me anymore. I mean, it just seems so outdated to use a harpoon anymore. Anything bigger than that just gives you pip. I mean, it's ridiculous. I have conversations and debates with people on these TRT pages on Facebook and that all the time. They're like, oh no, we use 25 gauge. Bloody hell, you're just going to take 15 minutes to plunger that into yourself? No, it don't. It takes 10 seconds maximum. If you're doing TRT, you shouldn't be putting any more than like 0.25 mil inside you at a time, and it takes 5 to 10 seconds. And the bigger gauge needle you use, the longer needle you use, you're going to get more pip, you're going to get more scar tissue. And the more scar tissue you get, the more painful it's going to progressively get every time you put that pin inside you. It's a tool. Carpenters don't use screwdrivers anymore if they don't need to. They'll use a drill. You got to keep up with the latest tools and use the latest gadgets, otherwise you're just putting yourself at harm. Why damage yourself or put yourself at risk when you don't need to? I mean, I always pin my legs now, and whether it goes in intramuscular or subcutaneously, I don't care, because it still goes in one or the other, but it don't hit any nerves or anything like that because it don't go in far enough. It gives me 0 pip, post-injection pain. I mean, on a scale of 1 to 10, the maximum I probably get these days is a 1. And that's because I can't be bothered sometimes. I just put it in me and I just inject it any old way without caring. Obviously, don't withdraw your testosterone with the insulin syringe. You backload your insulin syringes with a bigger gauge needle. I use a 27 gauge. I plunge my testosterone out with that and then backload it into the insulin syringes, and I use the insulin syringes to pin myself. Now, the latest trend sort of way seems to be every single day or every other day pinning yourself, but I know that probably is the best way. I know that, but for me it's not practical. You know, twice a week, even that's too much for me. I'd rather do once a week, but I know that's not sustainable. To get sustainable levels, you want to at least be pinning twice a week, so that's what I do, and I struggle with that sometimes. I can't be bothered with that, so there's no way I'd be able to do it every day. So all I'm trying to say is, if you're using anything bigger than a 29 gauge, just try it. Try the 29 gauge, try the 30 gauge, which I use. I think it's half an inch long as well. Just try it. Get away from the dark side and come to the light side. You will never ever go back. I promise you that. Stop being a big man, put your pride aside and try it. I don't care what your doctor says. Some of these doctors are wrong these days. I can't believe some of the stuff they advise. They'll tell you to inject 200 milligrams every 3 weeks. What the hell is that about? You're going to be going up and down like a yo-yo. You're going to be like a different man every 3 weeks. You're going to be like crying with depression 1 week, and the following week you're going to be like He-Man. It's crazy, absolutely crazy, these protocols I keep seeing. Obviously I'm not a doctor, and obviously you shouldn't listen to what I'm saying, but it's just me, my personal experience. I've been doing it for a year now, but I've been researching it every single day. I get fascinated sometimes. Once I get into something, I get absolutely fascinated, and I research it for hours and hours and hours every single day. And if you're wondering why there's not videos of me just like talking anymore, because I'd rather just show you videos of me working out. Hopefully that could put some fire in your belly to work out every day as well. I'm only doing little bits, but I'm doing something. So I'm just going to talk over that. I'm going to talk about mental health, my experiences with TRT, etc. Anything that comes up, whilst looking at videos of me working out or trying to work out with very shit form. I'm sorry, but I'm just getting back into it really. And I got an injury as well. I got nerve damage and I got a torn bicep, so